Welcome to the Dear NICU Mama podcast. Our mission is to connect the past and the present NICU mom by bringing them out of isolation and into a sisterhood of women who can stand alongside each other as we heal and grow both in and out of the NICU.
Our hope is that through interviews with trauma-informed medical and maternal mental health experts and vulnerable stories from NICU mamas themselves, that you would feel connected to the Dear NICU Mama sisterhood around the world. So, whether your NICU journey was 50 years ago,
or whether you find yourself in the NICU today, we hope that this podcast reminds you that you are not alone.
Hi, friends, and welcome back to the Dear NICU Mama podcast. It's your host, Martha, and
Ashley,
I feel like it's been forever since we talked. Just kidding. We just recorded one of these moments ago.
It's a back-to-back episode day for us.
It is. I'm feeling just energetic, lively, ready to go from our last conversation.
Me too.
And very excited about our new guest for this week's episode.
Yes.
You know, on the podcast, sometimes we have the opportunity to interview moms who've had NICU stays, to hear about their journeys, to hear about how parents navigate the NICU and beyond. And then sometimes we have the unique opportunity to interview incredible providers in the fields of neonatology and obstetrics and mental health. And today we have a very special guest because it's our first male provider that we've ever had. I think only maybe the third or fourth non-female identifying guest we've had on the podcast ever. So welcome to Dr. Eric Ricklin. We're so happy that you're here.
Thank you so much. It's a pleasure to be here and so excited to speak about everything.
Ash, you and Dr. Ricklin have a special connection. I'd love if you could touch on here.
Yes, we do. So about a year ago, I get this email from my photography account from Eric and Kayla, and I immediately fell in love with them. I was like, I want to shoot this couple's wedding, please. So they miraculously booked us to shoot their wedding. We go to the engagement session and we're talking about what they do for work, and Eric starts talking about his practice, and I kid you not, I remember setting down my bag and looking at you and being like, you do what? And so instantly told him about Dear NICU Mama and what we do, and low-key was like, I'd love to have you on the podcast sometime, and let that be. And then I kid you not, on the way home, I called Martha and I was like, we need to have him on the podcast. His specialty and his practice is amazing. And so fast forward to today, it's officially happening. I get to shoot their wedding in a couple of weeks, which I can't wait. And so Eric, we're just truly really excited. It's been a long time coming to have you on here. And so thank you so much for making time.
Absolutely. And I'm glad we can bring this to fruition. The dream is real now.
Real, yes. Well, and I kind of mentioned it before we started recording, but we were reading through your bio, and there's a lot packed into this, Eric. You are a very distinguished person. You have a lot of experience, both professionally, but also in your own personal life with this field. And so would you be willing to just introduce yourself, tell us a little bit about your practice, and who is Eric Ricklin?
Sure, yeah. So I recently finished my PhD in clinical psychology. So I guess I'm recently, thank you. It feels weird to call myself doctor. I'm not really ready for that yet, but that's what they tell me. And so I specialize in working with patients and families who have medical conditions and are navigating the journey of both hospital stays and medical procedures, but also coping and adjusting post medical procedures and hospital stays. I just finished my internship at the UCLA Stress, Trauma, and Resilience Clinic, which was also associated with the Family Development Program, or FDP, which is part of the NICU at UCLA, where I work with parents and couples who had babies in the NICU. And I will be starting my postdoctoral fellowship at the Children's Hospital Los Angeles, working with kids and parents and families who are navigating medical and mental health concerns. And so professionally that's me, but personally, part of me is that I was born with a craniofacial condition, which is a facial difference. And I was in and out of hospitals my entire early childhood, adolescence, and young adulthood. So I really feel as though I have a unique combination of both the professional and personal experience that I try to blend with the work that I do moving forward.
Yeah. Well, and to be totally transparent, Eric, when you told me about your practice, I naively didn't even know that these types of resources
Yeah.
existed. And so when you shared more about what you do, I just like took a breath of relief and fresh air because I was like, wow, I'm so grateful that there are providers who are dedicating their life to serving these patients and families so well and really dedicating their work to making sure that they have adequate resources to process these, oftentimes traumatic experiences and very like different childhoods than they envisioned, both for the kids themselves and also for their parents. And so thank you so much for the work that you do and for shedding a light on this because I didn't know that these resources were available.
Yeah, absolutely. It's been my pleasure. I mean, I think working with the families is just it's rewarding because it's so non-available in so many different places, and I think UCLA specifically has done a great job providing that support. It's not
Hmm.
always for everyone, and some people really do utilize it. For some people, it's a little hard to get into it eventually, but I think just
Sure.
having that option and the opportunity to speak with someone, like you said, to learn about resources for whenever they are ready, I think can
Hmm.
do wonders for their journey.
Yeah.
Yeah. Hmm.
So how, Eric, fresh-eyed out of undergrad, you have your, postgraduate and graduate work ahead of you. How did you kind of decide or land on the specialty in the area of research and focus that you did?
Yeah. So I always knew that I wanted to get back to the medical population. I decided at an early age that they've done so much for me that I would love to help similar folks go through similar journeys. I initially thought I wanted to be a biomedical engineer at one point and make medical devices, but I
Ash
quickly,
too. That was like number one choice, and a lot of people
yeah.
did.
Yeah.
It's a
Right.
good field, super awesome.
Yeah.
Uh, Realized I don't like physics, which is half the battle. So I was like, this is not for me. But also really wanted to do more direct work, and I think that was more behind the scenes. And I really wanted to help people directly. That's where I came and found and fell in love with psychology, and never looked back since joining that field.
Hmm. Well, and your experience is so unique in that you've been a firsthand participant, having your childhood be spent in hospitals and being a very frequent flyer, if you will, of going to a hospital. And so it's really an honor to get to ask you some personal questions too about what it was like because I know many of our NICU families, their kids are still quite young and they're still in like those early stages of development and things like that. And so to be able to talk with somebody who's an adult who we can ask some of those personal questions is really helpful. And so we're wondering if you'd be willing to share just a little bit about your personal experience of being a child that spent a lot of time in the hospital and how has it shaped who you are today?
Yeah, for sure. So I always considered the hospital one of my second or third home, really, because I spent
Mm,
so much time there. It would be weeks, days, sometimes, a month at most, but like it would be really a lot of time spent. Partially because I just had such unique condition that required a lot of facial reconstructive and jaw surgeries that required a lot of like post-surgery recovery. And I think, I was very fortunate to have such a caring and loving family to be there throughout the journey.
Mhm.
And I think having providers who really talked to me for me and tried to explain the situation was really, really
Mhm.
helpful. So I didn't feel like I was just a fly on the wall, but rather
Right.
involved in the care. And I think, being able to have that sort of really home life where it felt just so comfortable was really the best part and the most easiest way to transition for me. Um, without that doesn't go without having said that there's like been a lot of outcomes that have been less enjoyable because of my experience. I think a lot of anxiety, some potential medical trauma, and confidence concerns. And I think, that's mitigated by some of the work, that I've tried to do myself and that I try to provide to others. But at the same time, it's also taught me a lot about resilience and being able to
mm,
overcome some of the challenges, especially going through multiple visits or hospital stays or appointments, as well as having this compassion for understanding what it is to be accepting of where you are,
mm.
present in the moment, but then also to be able to then move forward and, get ready to take on whatever it is next. It's
Mm.
certainly a journey, and there's a lot of speed bumps along the way, but as long as you keep your hands on the steering wheel, I always like to say, I think you're the best way to navigate it.
Hmm.
Your family must be so proud of you that
Yeah.
way.
Yeah.
They do well.
Yeah.
They're okay.
You're like, yeah, they should be.
No. They're great.
Yeah.
They're my rock. I mean, I really
Mm,
think like that's the biggest thing that I always try to instill in folks is just like be there, be able to be present. And I know it's not easy for a lot of families, especially if it's like a single family or if it's like older parents who may not be available to take off work or have the resources. But I always like to say, even if there's someone who could be there in the process,
Mm.
if your baby's in the NICU or if your child's in the NICU, to be able to provide like a sibling or another family member or a friend or even a neighbor, just to be able to like continuously have that sort of guidance so they know it's as familiar as possible.
mm.
Mhm. Yeah.
What are some examples, from your experience of ways that providers, your loved ones, your family, your support system was able to kind of fill that gap for you and buffer your childhood a little bit? Obviously, we've probably come, tons and tons farther than we were even back in the 90s and the 2000s. In terms of how we treat, medical trauma and how we approach it from a pediatric perspective. But what are some of the tangible ways that you felt loved on and protected?
Yeah. I think like tangibly, I would say, just normalizing the experience as much as possible. So bringing toys or bringing movies or bringing video games or books or Legos. I was a huge Lego nerd. So having like things that I knew from my home to bring there to make it feel more like a nurturing and loving environment. Hospitals can be pretty cold. I mean, not to, you know,
Right.
make fun of any of the like architectural standings or things about the hospitals, but like it could
No, we
be,
can make fun of them. The hospital
yeah,
buildings can take it.
that's fair. They have enough money, they can hang with it.
Yeah.
Yeah.
But I think, when I've gone into rooms with patients and, or into NICUs, and sometimes, it's just a very cold and gray and sort of dreary. And so the ones that I feel like bring the most energy in life are the ones that like decorate it, that make it feel very comfortable, feel like nothing has changed. They're just in a different setting, but they still have that love and compassion and family oriented sort of vibe
Mhm.
together. Um, I think just more specifically in terms of like, I guess, energy wise, or just like, I guess, in terms of like non-tangible, but things that they've definitely done is, I think just being able to provide that confidence and that resilience as well. I think in terms of in the line of normalizing, being able to acknowledge that this is a challenging situation, but that
Mm.
this isn't everything that defines who you are. And I think that
Mm.
was really instilled in me in an early age that yes, I had multiple visits and I was there for a very long portion of my life, but there was still another like 2/3 of my life at least where I was doing other
Mm.
things that made me more of a typical kid or adolescent. And I think that's
Right.
always a good reminder, something to look forward to especially when it feels like this isn't going to end and there's no light at the end of the tunnel, but to have that hope and um, that sort of confidence that there will be, the end.
Mhm.
Yeah. That's beautiful.
Yeah,
And was there ever like a time where, or like a way that that message was delivered to you by like a loved one or family member where it like meant the most to you? Like what were some ways that your family communicated that to you? Was it how they said it? Was it how they were present? I mean, what were some ways that you felt that?
definitely. I think a combination. I think presence, right? Like my parents were divorced, and so it was, I imagine, very hard for them to like have to go co-parent while also navigating that.
Right.
But I think they did a really good job of kind of taking turns and always being there. So
Mm.
their presence was always felt because my dad would stay overnight and my mom would come during the day, and so I had both, and that was great. And then in terms of their words, I think just like making sure I realized I could be a typical kid, like allowing me
Mm.
to do things like play soccer or play, football, even though my parents didn't love when I played football or certain things like that, or some of the more dangerous sports. But allowing me to then do it and not really putting any limitations on it. I think they both would really
Mm.
insisted on doing that and not putting any sort of boundaries or things that, or telling me I can't do something. And
Sure.
I think just like always just picking me up. I think they just constantly shared that they were proud of me and ready for me to take on
Mm.
the world. And so hearing that consistently, I think was helpful, which I know is not always, people aren't always fortunate to have that, but it's helpful.
Yeah. But also encouraging for our moms listening that your presence and your words of love do matter.
Yeah.
You know, sometimes it feels like you're saying it and you're like, I hope they're hearing this. I hope that they feel my presence. But then to talk with someone who experienced that firsthand and be able to say, no, it made all the difference. You know, that's revolutionary for so many of us listening, of that your presence and your love is enough. It matters. So I think that's beautiful.
Absolutely. And I find that it's so hard too sometimes, especially for parents in the NICU, to feel that connection and to feel like, kind of like what you're saying, to feel like there's this understanding. But they, even though they may not always share that or they may not always show that, I mean, it could be a baby, it could be like a kid who's just like, I don't want to talk to you, I don't really want to hear this, but they still know it. And even just
Mhm.
saying it and making it out there, it still allows the baby, the child, whoever it may be, to connect with that. And that is probably the
Yeah.
most important piece.
Right. Yeah.
I don't know about you, Ash, but I have. I was just gonna say I don't know about you, but I have anxiety. LOL.
Oh, I have that too.
Yeah.
Yeah.
Same.
But I
Raise your hand if you have
right.
anxiety.
Right.
Hello.
Particularly, I have lots of intrusive thoughts and kind of ongoing worries about the effect of medical trauma on my kiddos and how it will come to fruition, or the way it might affect who they are and their life in the future. I'm sure that that is something common that we hear a lot from our audience. What would you say to encourage, or kind of a misconception that might surround kids who have lots of medical complexities or ongoing hospital stays, to help kind of assuage those fears?
Yeah. Well, I think like early on, one of the biggest things you can do to help sort of mitigate medical trauma and anxiety is by allowing the kid, or even if even the baby, just having them present, just be part of the journey. And so what that means to me is like being able to invite them to ask questions, being able to make sure the providers are talking to them just as much as the parents, if not more, to the kiddo or the baby.
Mm.
So that way everyone's involved and understands what's going to happen. I think one of the biggest challenges, or the biggest risk factors for medical trauma, is this fear of the unknown, or this
Mm.
like inability to really understand what's going to happen, because there's this sort of misconception that, oh, we need to protect our kid, we need to protect our baby,
Mm.
they shouldn't hear some of the challenges that are coming in. But what happens is that that sort of mitigates or impacts some of the expectations that they might be feeling. And
Mm.
so they might think, oh, this is, especially if someone going through multiple procedures, they might think, oh, this is the last one, this is it. And then to have that next one come up and be like, wait, I didn't know that, I thought there was going to be
Mm.
more, can really induce anxiety and medical trauma. So that's why it's always important to have folks be able to like write down questions beforehand, allow them to ask the questions directly if they're old enough to, of course, and just be in the room and present so they can at least hear. And really promote. I strongly always recommend promoting doctors or providers to talk directly to the kiddo, because I think a lot of times they're talking to the parents and it makes it feel like the kid's not important, when in reality they're the ones
Mm.
going through a lot of it.
Right. Yeah.
I had never thought of that before, so I will write that down.
Yeah. Right. And, when we've talked as a team, because many of our kiddos are still like 3 and under, or they're starting to get to those ages where they're starting to begin to ask questions
Mhm.
about their birth story, or, why are we going to the doctor again? Or what is this? And different things. And so we're kind of in this new stage of parenting, of like trying to also like walk through these questions with our children. And so, what are some ways that we can prepare for those questions well, and really access maybe some of the resources that you're aware of, okay, this is how I talk to my child about medical trauma, or, medical procedures, or their birth story, or, they see pictures of themselves and they're like, why did I have all those wires? Or, what is this? And
Yeah.
so, do you have any
Mhm.
insight on how to have some of those conversations as our kids get older and more curious?
Yeah. I think one of the biggest resources that I always recommend to folks, it's called the National Child Traumatic Stress Network, or the
Mm.
NCTSN. It's ncsTN.org. And it's a really great resource for medical trauma, for patients, for providers, for families. And it provides a lot of handouts to kind of manage medical trauma, sort of the stuff I'm talking about in terms of questions, preparing, sort of responding to inquiries by anyone. But then also just has a lot of information on trauma-informed care. So that's one that I really highly recommend, especially for those who are curious about medical trauma. And then I think it just in terms of how to respond to some of the kids, I think just thinking about ways that are developmentally appropriate for them, but then also being able to um, respond in an open and honest way that they can then hear. If they have more questions, because we know kids are always going to have questions, I think, you know, referring to the website could be helpful, or just being able to like think about it, have an open discussion with them as much as possible.
Right.
That's so interesting. My daughter had a hospital stay a year ago, and it just occurred to me, I just remembered, but there was this like incredible handout, and it was all about developmentally appropriate per age group, different ways you could talk about what the experience was. And some, I don't know if it was child life, who knows? I feel this is the other thing. People come in and out of the rooms, but they walked through, here's 3 different ways that you could talk about it. And having those talking points was so helpful. And, now I know I need to go dig that up, because my daughter is asking questions. Last night she asked me why babies are born without teeth. I did not have an answer. So I need to, this is something, I definitely need to look that up, and that resource that you mentioned. So
Yeah, for sure.
yeah.
And I think that's another really important piece too, right? Like the developmental piece. Like people are going to be able to communicate and ask questions in different ways, and just being mindful of that. So, for example, like a baby might respond in a way that's more behavioral, like crying out or acting out, that we can't always address. But then there might be like a 2 or 3 year old who's starting to ask questions and they can't really have the emotional language to describe it. So something that could be helpful is like pictures or colors or things that they could draw or use to allow them to communicate how they're feeling or what the question might be without having words to go along. Whereas someone older who might be more like 7, 8, 9, 10, or the schooler age or even older might start to have that language, and then to be able to understand more from an emotional lens as well. So just having that like kind of knowledge and know that there's going to be different ways to describe things to different kiddos.
Yeah.
Right. If you are a longtime listener of the Dear NICU Mama podcast, or you have found yourself enjoying this episode, we would greatly appreciate a review on iTunes.
Reviews on Apple and other platforms help other mamas and friends just like you find our podcast, help boost us so that we are more available and accessible to others, and they let us know that you're loving what you're hearing too.
So we love to hear the stories that you're connecting with. We love to hear how the episodes resonate with you, and having that review is a great way for us to get a really tangible feel of how this podcast resonates with your heart.
So playing off of that question, then, Dr. Ricklin, because I'm going to use up the doctor because it's brand new for you. But we have a lot of members of our community. There's a lot of intersection between ongoing, global disabilities that affect communication styles, and a lot of these kiddos are nonverbal or communicate in different ways. How would you suggest that those families start approaching conversations and communication with those kiddos around medical trauma?
That's a great question. So I haven't had as much experience with nonverbal folk these days, but I know that there tends to be resources within different states that could allow for like more assistance with some of those. Like for example, like regional center we have in California, and I know that could be helpful in some ways. But I think in terms of like having that conversation and being ready to experience it, I think it's similar to someone who might not be able to express the words verbally. So perhaps like be able to like draw or like kind of help like with more like art therapy in that way could be really helpful. Or music therapy could be really powerful in a lot of ways. So finding maybe therapies or interventions that could be helpful to sort of express things that necessarily don't rely on verbal or written, or not written, but verbal or like expressive in this sense, in the typical sense, I would say.
I think one fear that a lot of us have in the community whose kiddos do have recurring stays or have ongoing medical appointments or things that maybe just impact childhood is this fear that our children will resent us because we're the ones that bring them to the appointments. We're the ones that make the appointments, different things. And I wonder what words of encouragement you would offer to parents being a child on the other side of this, but also with your practice to kind of dampen some of those fears and maybe remove a little bit of that shame and guilt that we feel. Because oftentimes as NICU moms, we tend to take a little bit of that responsibility on ourselves, whether that's we should have caught this sooner, or I should have, if I wouldn't have delivered early, then this wouldn't have happened, all of those different things. And so what hope or encouragement would you offer those families and moms listening that feel those fears and those feelings of oh my gosh, am I doing this to my child?
Yeah, absolutely. And those are very, very common, as you're saying. Like those are some of the most, like the guilt and the shame are some of the most common feelings that I see happening when I talk to NICU mothers or parents or caregivers. And I think it's really hard to navigate because it's a constant feeling, but then also kind of like what you're saying, it's sort of reinvigorated when you have to go back, or you're
Mhm.
re-experiencing something, or your child might get angry or frustrated with having to deal with it again. So I think the first thing I always recommend is just compassion and try to manage self care as much as you can. Whether it be just like accepting that these are the feelings and that's okay, but then finding things to bring yourself joy or bring yourself care, because knowing that these are things that need to be done, but you're doing this for the goodness of your child, not to actually, put them in harm's way, but it's what's needed, which is a work in progress. It's not an easy thing to have that compassion, but to remember that, there is more. This is why you're doing it. And then I think, just know, I don't think this is always the case, but I do think a lot of times, when kids are going through this sort of resentment or sort of this anger or this frustration, it's a lot of times either they're confused or they're not clear with what's happening, or it's just, just frustration because I don't want to do this again. And
Mm.
those feelings are just temporary. And a lot of times, at the end of it or on the other side, kids generally are like, okay, you know what? Like my mom, my parent, my dad, whoever might be, my caregiver, really did this for me. And they
Mhm.
tend to understand, have a better understanding. So in the moment, it can be really challenging. And, throughout the early portion, it can be really difficult to, overcome some of those. But I think just making sure you give yourself that understanding, compassion, give yourself some self care when you need to, doing things that you enjoy that might take a step away, normalizing it, maybe joining. I always like to say joining groups that also have moms who are also going through it. Just like you're all promoting on this wonderful podcast, I think that is great. Just having that sort of connection and shared experience really can take go miles in a lot of ways.
Mhm. Yeah.
So let's say you're a parent or parents of a kiddo that has an upcoming procedure or stay. I think of our, CHD or heart families and, transplant kiddos, anyone who has any sort of breathing assistant, lots of trach kiddos that come out of the NICU. So, you have to prepare them ahead of time, or there's upcoming procedures. What can you do to support them? What's a good place to start ahead of time to help prepare?
Absolutely. I think so. Navigating expectations is always a good piece. So, really understanding what is going to happen, what your possible stay might look like. Again, bringing things that might be familiar if you're doing a stay, bringing things that could really connect you back to your outside world, the outside of the hospital, and really also knowing what's going to happen after. Because that's another piece, is that a lot of times people have expectations that, like, either this is, especially for heart transplant, like this is going to cure me, or I'm going to be able to run like 10 miles after I get my new heart, which is, sometimes the case if you get a really good transplant, but a lot of times it's a recovery period, and knowing that there's going to be a ramp up. So I think
Mm.
mitigating those, having this understanding of what that looks like could be really helpful. I think also just, having some, like, again, navigating any of these cognitive and maybe negative thoughts or feelings about what might happen. So a lot of times there might be like worries and anxiety about that. So being able to do some work around that I always recommend. So things like, um, well, I mean, soothing is good, but like therapy can be helpful for that, or just like having open dialogue about what those thoughts and feelings might be, and really understand, are
Mm.
these like realistic thoughts, or these thoughts that are just anxiety, and whatever they are, it's okay to have those thoughts, but then to also practice like, okay, well, what are the other pieces to it? What else can I do to
Mhm.
prepare, or what else can I do
Mhm.
to sort of mitigate those negative thoughts, or do to manage that.
Mm.
And then also, I guess, lastly, like just being able to have good coping skills. I think those are really key, especially just along the lines. So things I recommend are just like deep breathing is really helpful. I'm really big into mindfulness and meditation can be helpful. Grounding techniques, like things that just kind of put you in the moment. There's this really great one called 5 4 3 2 1, which kind of uses your senses, or using things like categories, or just describing objects around. Because what it does is, a lot of times, especially when you're getting worked up for procedures or worked up for the future, you start to snowball or spiral in a lot of ways. And I think that
Mhm.
happens a lot for folks. They think about one thing and they're like, oh gosh, something else is going to happen, and then this is going to happen, and then my child's going to
Yeah.
become X, Y, and Z. But if you're able to sort of slow that down and stop it before the snowball gets too big and overcome to help, then it really can kind of break that stress levels and kind of get you back down to ground zero.
Mm.
And as you've been talking about this, a question came to mind that kind of reminded me of a piece of my own journey with my son in the NICU, is it being probably one of the worst pains of my life was seeing my child in pain
Mm.
and seeing them undergo a procedure or a surgery, or seeing them need breathing support. And I remember when my son needed, before his hernia surgery, he would scream in pain. And I, as parents, you just kind of do it, right? You muster up the courage to be there, but it feels very unnatural to see your child in pain, and as it should, right? But what encouragement or pieces of wisdom would you give when it's just really hard to be fully present because it just hurts so incredibly bad? I mean, do you have any insight for the parents listening who it rocks them to their core to see their child in pain, and yet you want to be strong for your kids, and sometimes finding that strength is really, really hard.
Yeah. I think it's so hard. I think that it's like you said, it's not natural. It's not a natural thing to experience, having your kid be in pain and screaming and just so hurt. And that causes you hurt because your kid is a part of you. And so I think that it
Mhm.
makes this connection even stronger in so many ways.
Yeah.
And I think, one thing that I like to tell folks is sometimes is that it's okay to have that. And it's okay to be in that pain and to share that and to acknowledge that, because it's just a great release. We could put up these strong faces and put this together, which is awesome, and it's super super great because your kid will see that it's okay to, that they're going to get through it. But other times it's okay for them to see you in sort of a more vulnerable place, because it allows them to
Mm.
then be more vulnerable and to know that this
Yeah.
is a challenging situation. Um, I think, one of the things that, that I knew from my parents growing up is like, I had very two sides of the coin. My dad was very like, no, it's fine. Everything's going to be okay. This is great. This is, what they call like more toxic positivity. And my mom was the other side, where it was like, no, we got to worry about this. We have to worry about this. And like finding that middle ground is super, super important. It's really okay to
Mm.
have that positive attitude and say things are okay, because then you're not going to be able to, you're going to think everything's going to go wrong if not. But at the same time, it's also okay to worry and be concerned and have that fear and be really down. And that's just part of
Mhm.
the journey. But then it also shows your kid that it's important to think about those things. It's important to show those
Right.
feelings, express those, and to be able to then process them even more so.
Right. Yeah. No, that's powerful. And I guess too, how important or how beneficial is it to have a professional help you walk through, some of these conversations? Because again, I didn't know that resources like yours existed, but now that I know that, it's like, wow, like that will be really helpful as Silas gets older, because he'll need yearly cardiology appointments and different things. But to have a professional in the room to help parent and child process, or just parent or just child, I mean, how have you seen your work benefit families, and what has that looked like over the years for you?
For sure. I mean, I will say I'm biased because I'm a
Right.
psychologist. So, but I will say that I mean, I think it's incredibly powerful. You know, we've done interventions where it's, you know, parents and kiddos going through and really retelling their story in different ways. So
Mm,
there's one we call like a narrative timeline where the kiddo kind of explains what they've experienced growing up, either with their hospital stays or their doctor's appointments, or even outside of the hospital, say parents fighting or the stress involved with that indirectly, and then the parents do as well. And then both of them share that and kind of understand really what both sides are going through. Because I think one of the pieces that I've noticed, and that's a common thread for a lot of families, is that they don't always communicate what their side is going through, and they don't know what they've experienced. Either the kid doesn't communicate what they're experiencing to the parents, or the parents don't experience, or they don't parents don't communicate what they experience to the kiddo. But being able to
mm,
understand that and come to a mutual understanding and realize, okay, it was tough for both of us. We both had these stressors when this happened. You had this stressor when this happened, whereas I was stressed when this happened, and it just allows for this really bond to form in a lot of ways. And then they really are able to then overcome in a lot of ways because they realize it's part of their journey, but they shared it together, and there's a lot more to it for both of them or all of them.
right.
That is
That's so good.
that's such a cool practice. And I could see it being so valuable for so many members of your community because it feels very isolating when you're in the middle of whatever trauma you're experiencing. And you know it so well from your body, but pulling it out so it can be a piece of connection between you and your child and your partner and other caregivers seems just invaluable.
For
Mm-hmm.
sure. And I think, you know, even from a young age, folks can do that too. Like kids are
Right.
very impressionable, as we all know, right?
Mm,
And I think that they have language, whether it's like drawing or just like kind of expressing it a certain way, and be able to understand that at a young age from these kiddos can be really, you know, it's really awesome to see too. Just seeing
yeah.
so profound some of them can be,
Right.
even when they don't always have the words.
Right.
Yeah. I think probably we all have circumstances where our children, even if they're young or whatever developmental stage they're at,
Mm,
of them having kind of an awareness beyond their years about these things that is sometimes more well managed than adults in their emotions. You know,
Right.
uh, they have an ability to bounce back and understand that maybe more so than we give them credit for sure.
Well, I know we're getting kind of close to the end of our episode here, but one thought that came to mind, and I know this is sometimes more the role of like a child life specialist, but is families who have kiddos that are medically complex, but then have siblings.
Oh yeah.
And, feeling like compared or feeling jealous or like, how come they don't have to go to the hospital, but I do, or even just wanting to include their siblings in their journey. And, do you have any insight on that dynamic and what parents can do or any insight on that?
Absolutely, yeah. So at a personal level, I have an older sister who went through a lot of the things you were just describing.
Mm,
So feeling less than, feeling not given attention, feeling like why can't I join? What is going on? Not really being informed. Um, and you see this a lot with siblings. There's a whole research side of research that looks at children or siblings of children with medical conditions, and it's really hard for them, just as hard as it is for the parents sometimes.
right.
And you know, one thing that I think can be really beneficial for parents is to try to find a special time on a consistent basis with those kiddos, with the
Mm,
siblings, just the siblings, because it's going to be very easy. And I know this isn't always easy for parents because they can be really tired and there's a lot going on, but it can be really easy to just go through the day, especially if you're in the NICU, to be constantly in the NICU and then come home and like be exhausted. And then I just want like my alone time, which is very needed, or I just want to go to bed, which is also needed. You need sleep. But at the same time, we could then lose sight of some of the other kiddos who are a little older, who still think something's going on, but they're not really sure, and they're not getting that time. So really trying to make
mm,
an effort, even if it's like 10 or 15 minutes of special playtime or a movie or whatever it may be, something to really connect just the parent or caregiver and the other sibling, which will allow them
sure.
to really feel that special connection and allow them to really understand, hey, like, even though this is going on with my sibling, my brother, sister, or other sibling, um, they still really care about me and they still want me around and involved. And I think that could really, you know, go a long way.
Yeah,
Yeah.
for sure. No, that's so good. And I'm how is your relationship with your sister? Not to put you on the
No,
spot, but,
yeah,
like, do you feel like
it's
it's been cool to be able to talk about that now that you're older?
absolutely. Yeah,
Yeah.
we both done like, we both done a lot of work, and I think
Yeah.
I mean, she's probably my closest person in my family now, and
Oh,
she is just
Oh.
I love that.
incredible. Yeah, it was definitely hard. I think like there's also this aspect of like resentment towards the kiddo, and so I think she held that to a certain extent, which is rightfully so, right? Especially if you're not understanding certain things, to be like, well, why does he get attention? Like, what's so
Right.
special about him?
Yeah.
And so I think there's anger and you know tension a lot of the way,
Yeah.
but growing up, we started to understand where each side of the journey
Mm.
was, and it's kind of going back to what I said. You can understand where that person's coming from and communicate that, and are able to sort of, you know, bring awareness to the different experiences. It allows you to then to have more empathy and compassion for them,
Yeah.
and it allows you to then grow and move forward in any way. And I think we've done a lot of that. I think that's what I always recommend for folks is to
Hmm.
try to bring that awareness, try to bring that understanding,
Yeah.
and it's a journey, but
Yeah.
there's an end to it at some point, in a
Right.
good way, not a dark
Yeah.
and not
Right.
a
Right.
not an end. We're all gonna end sometime journey.
Yeah.
Right.
Is she like your best man or something? Is she in the wedding party?
She is in the wedding party. She's on the bride's side, so she's
Yeah.
a bridesmaid, but she's a very special bridesmaid. I like to think. But
Yeah. Oh,
Yeah.
we have
yeah.
And
like
then when you're on the other side, then you can like give her like thumbs up and stuff, so
exactly.
she
I'll
can
just
see
walk
you.
over and give her like a high five in the middle. Be like,
Yeah.
go do
There you
it.
go.
But yeah,
Oh
she's
boy.
there, and she's
Ash is
very
really
good.
loving all the things I'm gonna
The
inspire for this wedding
the
day.
photo ideas are great, Martha.
Excellent.
I didn't think of that one, so I really
Okay.
appreciate that.
We'll have to do like that Parent Trap. What's that from like the Parent Trap handshake? Maybe we'll just do that in the middle.
Oh yeah, the
It's a
secret
lot of
handshake.
choreography, but don't need to do it.
Okay, that sounds good. So I'll send you the photo list, Ash, of all my
Thanks.
different
I would
ideas.
really appreciate that. Yeah.
Excellent.
Thank
Yeah.
you.
So next week, we're having a companion episode to this one where we're going to talk with your colleague, Dr. Augustina Bertone. Fingers crossed that I pronounced it correctly. We'll find out next week. But she's your colleague from your internship, right, at UCLA. And that is an incredible program. Can you talk a little bit about that program briefly and how families in the area would access it?
Yeah, for sure. So it's part of the Stress, Trauma, and Resilience, or STAR clinic. It's called the Family Development Program, or FDP. And what they do is they provide therapy, resources, consultations to parents and families who have babies in the NICU. Dr. Augustine is a wonderful resource. She's a therapist there, and they provide either phone consultations, in person, or virtual sessions. And so it's mainly for folks who had babies at the NICU at UCLA. So if you are a parent who had that, then just ask your child life specialist or ask your provider in the NICU, and they will refer you to the Family Development Program. And then they'll contact you, and you'll be able to have free sessions. It's all free pro bono. They go through insurance, but if for some folks who have no insurance or financial limitations, then they do offer free sessions, or they refer out to other providers in the area as well.
That's incredible. What an awesome, awesome thing.
Yeah,
So cool.
yeah, she's a rock star. So what I was
That's
telling
so great.
Ash, she's one of my favorite people. So she will be a wonderful addition for sure.
Well, and for families that aren't based in, at the UCLA clinic, I know you mentioned a resource that we'll make sure to link in the show notes. Do you have any other, recommendations of places to start that we can make sure to link?
Definitely. So I have a couple different other organizations that we generally provide as resources as well. So there's the National Perinatal Association, which has a website, nationalperinatal.org, and they provide a lot of advocacy and education for parents and families who need perinatal care or have babies in the NICU. And it's a really wonderful organization. They have a ton of different resources. There's also Maternal Mental Health Now, which is another really great resource. It really promotes like well-being and emotional awareness and therapeutic services to parents and particularly mothers who need assistance in that as well. That's a really great one. They also have a wonderful training, but they also have a wonderful list of providers in the national providers as well. So if you need assistance there, which is great. And then the last one I always love because this is another sort of more mental health, but it's the Postpartum Support International, or PSI,
Yes.
which is
Yep.
great. And I'm sure you've heard of most of these already, but these are
No, but
ones,
I'm so, yeah.
these are great.
Anytime we can plug these resources, we're like, let's shout them off the rooftops. Like we
Absolutely.
want moms to access these. So,
For sure. Um,
so cool.
and they're all great. And I have one more just again for California, but we don't. I mean, it's called Our House, and it's really great for grief, especially because I know one thing we didn't always mention is for some folks who have babies in the NICU when they pass away or it's unfortunate circumstances, like having that grief resource is super super helpful. And it's a process, right? It's not one and done. It's a very long standing process, and the Our House folks are like incredible at like providing that support for parents, children, siblings, things like that. So I always love to plug them because they really have helped a lot of my patients in the past as well.
Mm-hmm. And would you say that those resources would also apply to like parents looking for resources for their children?
Yeah, for
Okay,
sure. So a lot of them have like just like especially the Trauma Network one and the Maternal
sure.
Mental Health and PSI, like they all have like groups and things. Some of them, not all of them, but some of them have groups. Some of them just have handouts of resources. They can have they help find providers that could be specific for children as well, especially
Cool.
like siblings or just younger children. Those are
Yeah.
really, really helpful. And then
Yeah.
Psychology Today, which is another really good resource, but that's more for psychology services.
Sure.
Yeah.
Yeah.
This has been so wonderful and informative, and
Yeah.
now we got to go update our resource library online with a bunch of new fantastic ways. And it's just wonderful to hear about someone with lived experience who has gone on to be a provider that has changing lives, right? Being able to be that present provider and provide a level of understanding and strategies and just support for families is a game changer. So thank you so much for all of your work.
Yeah, of course.
Yeah.
It's a pleasure. And thank you so much for having me. It's been a wonderful journey.
Yeah. Well, and what I love about this episode so much is I think sometimes we so badly, and right, like this is only natural, but we want to shield our child from any pain. And we don't want them to think too much about their childhood, especially experiences in the hospital that might be hard. But I think what this episode has given parents permission to do is to heal alongside your children and to get to be a part of processing that experience with them, because that's where that new bond is formed. And so I love that in a way, it's like celebrating your children's unique childhood journey and getting to be a part of it in a really unique way. And so I've loved that recurring theme throughout this episode for sure. To all of our NICU mamas listening that have maybe medically complex kiddos, disabled kiddos, or just find themselves in a recurrent hospital stay with their children, we hope that this episode reminded you today that NICU mama, this is not your fault and you are not to blame. And that bonding and having that special relationship in childhood with your child is possible. In fact, it's more than possible. We hope that you are able to take a little bit deeper of a breath tonight, knowing that there's resources available to help process this. You don't have to do this alone, but also how resilient your child is. And know that every mountain they've had to climb is because you've been right there next to them. And I'm going to start crying. But your presence and your love is what guides them and moves them. And you should be incredibly proud of the relationship that you will continue to have throughout their lives. So, Eric, thank you for being here. Thank you so much for the work that you do, for sharing about your personal life experience, but also for just being a beam of hope for parents everywhere and children everywhere. And mamas, we love you. We love the sisterhood. And we love your kiddos. And we are celebrating every milestone that you reach. Have a wonderful rest of your week. Thank you so much for listening to this week's episode of the Dear NICU Mama podcast.
If you loved this episode, we'd be so grateful for a review on any of the podcast platforms.
And we'd love to continue connecting with you via our social media pages or a private Facebook group. And ultimately, NICU Mama, welcome to the sisterhood.